Hello, I'm Donna Friesen. We're all finding ways to cope in this new reality, getting accustomed to living a physically distant existence. But there's nothing normal about this. Silence and emptiness where there's usually hustle and bustle. It's disconcerting. Social distancing is not what cities are designed for, and it's not what most humans are wired for. We've shut down so much to keep COVID-19 from spreading because this is a physical health crisis. But there's something deeper going on inside us. It's sowing the seeds of a major mental health crisis. Whether it's grief over a loved one's death, fear of getting sick, anxiety over losing your job and not being able to pay the bills, psychological distress is widespread. And the stresses have multiplied, especially for those dealing with mental illness before the pandemic hit. Abigail Bimman explores the impact.
Dealing with a pandemic is an extra challenge for Christina Del Corpo. The Montreal woman has general anxiety disorder.
Because we're all going through this giant traumatic experience, it's definitely easier for me to get set off and to start panicking. So that's why I have to be extra vigilant and pay attention to my emotions.
But after the year she's had, that's not easy. Struggles with infertility, her father had a stroke, and then Del Corpo planned to start her own design and digital marketing business. Excited for a new challenge, she quit her job in January, right before the world shut down.
There are some days where I'm just terrified that, someone I love will get sick, or maybe we're going to lose our condo, or, I won't be able to find a job after all of this is over because there's so many other Canadians that are without jobs.
Del Corpo knows she's not alone. Health Canada tells Global News 11 million Canadians will show high levels of stress in family and work settings, and 2 million will show signs of traumatic stress. Projections based in part on the aftermath of SARS, where more than 40% of Canadians suffered from increased stress levels. But by the time this pandemic is over, numbers could climb even higher. Separate polling by both Ipsos and Angus Reid show half of Canadians feel their mental health has already worsened.
We know that it's not just a secondary wave, it's actually happening right now.
Our service volume has doubled for young people who are reaching out for support.
An increase of about 50% more calls than we were receiving this time last year.
Two examples from organizations on the front lines.
Typically what we would see is social isolation, increased concerns around mental health or symptoms that they're experiencing. And what we're seeing with COVID is an increase in all of those things, that they've been somehow amplified.
It's also meant a change in how mental health workers provide that desperately needed support.
Gerstein Centre, this is Donna.
Toronto's Gerstein Centre was forced to close their short-term beds and park their mobile crisis van. Now they're focused on calls and wellness check outreach, but it's not the same.
As soon as we can get back to face, the better.
Yeah. These staff take calls for 12 hours a day. And in a pandemic that can feel endless, the mental health of frontline workers is also a concern.
There's still this lingering concern of going into work and working in close contact with people and potentially contracting the virus.
Courtney Jackson just launched The Front Lines, a publication on Medium encouraging other workers to share their stories. She's a mental health case manager at a residential care facility in Ontario. Burnout is a real problem. So is isolation, with many healthcare workers self-isolating from loved ones within their own homes.
I mean, working in the mental health field, you expect to deal with stress and change. It's part of the job, but the difference is that right now I'm working with people who have a limited understanding of the situation. They feel powerless to the situation, but I myself also feel that way.
So in a country that saw long wait times for mental health services before the pandemic struck, what's being done to help? Healthcare is a provincial responsibility, and a number of provinces have stepped up with new programs and millions in new funding.
Help is available.
Alberta is leading the way after a government survey found 74% of Albertans feel their mental health has been hit by COVID-19.
The $53 million additional investment that we're announcing today is more than all of the other provinces.
But what's being done at the federal level? The Prime Minister keeps promising all kinds of help, but the fact is there's no clear number on new mental health dollars coming from Ottawa, as the funding is tied to other things. This month, the Prime Minister committed $240 million to boost access to virtual care, including mental health. And $25 million of that is going to the new Wellness Together portal, connecting Canadians with free help, including phone, text, and video counseling.
There will be more to do, and we know that this secondary pandemic, if you will, is just as in many ways. As a matter of fact, I would say it's just as urgent as this one.
In its first 3 weeks, more than 150,000 Canadians used the portal. Help is offered via a number of partner agencies, not government employees. After 8,000 volunteers answered a call from Kids Help Phone, now the service known for helping kids is responsible for all the texts that come through the portal.
Anybody that texts, whether they're a youth or they're an adult, will text 24/7 and reach one of our trained volunteer crisis responders. And those are volunteers that go through a rigorous training process, and they're overseen in real time by paid professional staff.
But the site does ask you to provide your name and email. The agency overseeing it says there is help available without registering, and the data is only visible to the person submitting it, designed to be like a Fitbit.
We know that outcomes with mental health improve if people are able to see their progress as they're moving. So that's the only reason it's there.
Peter Cornish says they're working on a way to make registration optional as they brace for increased demand over the next few months. He says as it develops, peer mentorship will become more important.
So that everyone can support each other better, which is why we came up with the name Wellness Together Canada.
Christina Del Corpo is managing pretty well these days, and she wants to help others too. So she's been blogging.
You didn't always feel this stressed out, this bad, and it's gonna pass. And just keep that in mind and keep pushing forward. And if you really need help, reach out to someone.
The battle cry of this pandemic has been, we're all in this together. Or, put another way, you're not alone.